Hi, I'm Jayson Lusk, Distinguished Professor, Head of the Agricultural Economics Department at Purdue University. So for the past year, the Center for Food Demand Analysis and Sustainability that we've been running here at Purdue has launched a new survey, the Consumer Food Insight Survey. This is a monthly survey of over 1,200 U.S. food consumers. We conduct the survey every month, so it gives us an ability to track, keep a pulse on what consumers are thinking about their overall food economy. Just released the November results, and what we're seeing is stability in a number of our measures that we keep an eye on, such as sustainable food purchasing patterns, food insecurity, and food spending. Interestingly, food spending has remained steady. It was increasing for a while, but has plateaued. And that's interesting in light of the fact that everybody knows that food prices have been going up for the course of the past year. So if prices are going up and spending has remained about the same, that means people are probably buying less. And so that's really the first month that we've seen spending start to really stabilize and maybe suggest that consumers are starting to tighten their belt buckles just a bit. One of the measures that we've really been keeping a close eye on is food insecurity. This is essentially a measure of whether people are able to afford enough to eat. This is a measure the government tracks, but they only release their measure once a year. But this is a dynamic measure, particularly in a time of rising food prices, we want to keep a close eye on. That statistic has remained fairly stable over this year-long process that we've been recording the measure, but we do see a lot of variation across different kinds of people. So for example, the middle of the country tends to have higher rates of food insecurity, particularly the South, as compared to the coasts. But that's the number that we're watching, even though it hasn't started to uptick just yet. The other component of that we're watching is whether people say they've been to a food bank or gotten free food at different social services. And again, we aren't seeing much of an uptick yet in that number, but that's one we really want to keep an eye on, because that would start to signal some concern about really well-being, particularly of low-income households, if we started to see those numbers rise up. So fortunately, we're not seeing a big increase in those numbers yet, but it is something that we are watching. Absolutely. One of the great things about doing a survey on a routine basis is we can respond to current events, and holidays are also an event that comes around on a seasonal basis, so we could ask people about their expectations about the holidays. So for example, coming into the Christmas season, in this December survey that's coming up, we'll ask people about whether they're concerned about being able to afford money for gifts. And if they are, where are they going to cut back in their budget? Last month, when it was Thanksgiving, we asked questions about people's plans for gathering together, whether they plan to buy a bigger or smaller turkey. And so we can really get a real pulse on what people were thinking. By the way, people plan to travel a bit less last Thanksgiving, but have bigger meals than they had the previous year. This month we added some ad hoc questions. These are questions that we don't routinely track, but we'll just add in response to current events or other issues. There's another group that I conducted a survey of food experts and asked experts' opinions about various food policy issues. And we thought it would be interesting to compare those questions, the answers by the experts, to our general consumer survey. And we asked some questions about people's beliefs about what caused the rise in obesity. The general public thought that a reduction in exercise was one of the big contributors, and that's not necessarily what all the experts thought. The other one was when we asked about sort of policy-related issues that they favored or disfavored in terms of trying to improve public health. It's pretty clear from our survey that people preferred carrots over sticks. They liked policies that tried to expand healthy food access. They really didn't like policies that, for example, increase taxes on unhealthy foods.